Welcome, and thank you for taking the time to watch this demonstration on meaningful use, how to achieve the core and menu measures. This video demonstration will cover menu measure number 5, patient electronic access. Let's get started. First, let's open up the PDF from the MTBC website for patient electronic access. This is the eligible professional meaningful use menu set measure number 5, patient electronic access. And the objective here is to provide patients with timely electronic access to their health information, including lab results, problem list, medication lists, and allergies, within 4 business days of the information being available to the eligible professional. The measure here is for at least 10% of all unique patients seen by the eligible provider are provided timely electronic access to their health information. And so that information must be provided within 4 business days of it being updated in the EMR. And the exclusion here is any provider that neither orders nor creates lab tests or information that would be contained in the problem list, medication allergy, or other information during the EHR reporting period. So the exclusion is a bit narrow if you have a practice that does not have problem lists, medication lists, or allergy lists, or lab results. And otherwise, you'd have to provide this for at least 10% of your unique patients within 4 business days of it being updated in the EHR. So let's scroll down and see a little bit about the definition of terms. Again, business days are Monday through Friday, excluding holidays. And unique patients, if a patient is seen more than once during the 90-day reporting period, they're only counted one time. And the attestation requirements are, again, numerator, denominator, and exclusions. Denominator being the total number of unique patients, and the numerator being the number of patients within that denominator who had timely electronic access to their health information. Let's take a look at some of the additional information which can help us understand this menu measure a little bit better. Online electronic access through a patient portal or a PHR will satisfy this measure, and the MTBC EHR connects securely to the MTBC PHR. And the way that the MTBC PHR, or the personal health record, the way that it's delivered is through a website that we create and configure on your behalf. We're going to take a look in a moment at the MTBC PHR and see what kind of information is provided there. But first, an eligible provider may decide, this is additional information number 2, an eligible provider may decide that electronic access to a portal or PHR is not the best forum to communicate results. Within the confines of the law governing patient access to their medical records, we would defer to the eligible provider's judgment as to whether to hold information back in anticipation of an actual encounter between the provider and the patient. So what it's saying here is that you may decide that there's certain pieces of information that should not be given to the patient until you've had a follow-up visit with that patient. And you have the ability, using the MTBC system, to decide what information is shared with the patient and what information is withheld. The objective and the last additional information point here is the objective and measure focus on the availability of access and the timeliness of the data, not utilization. Meaning it's not your responsibility as a provider to make sure that 10% of your patients have that access. What is your responsibility is to make sure that that system is available to those patients and that the data that's updated in the EHR goes to the PHR within 4 business days. So the measure, again, is only to make sure that that capability is there. Whether or not 10% of your patients use it is not your responsibility to ensure. What is your responsibility is to make sure that it's live and active, and if your patients wish to use it, that they could go ahead and use that system. So let's take a look in the MTBC system and see how this will work. Whenever any material is updated in the EMR for any patient, whether it's demographic or insurance information or appointment details or clinical material that's contained in the charts, including such things as immunizations or past medical problems or assessments and medications, that information gets transferred over securely to the PHR system. Let's go ahead and look at a PHR for an existing demo patient. This would be the main page of your website, a website that MTBC will create and host on your behalf, where it has some information about your practice, where patients can meet the doctor, review your accepted insurances, view directions and office hours for your practice, access some excellent patient education resources, answer some billing questions, and complete some online forms. But the real heart of the PHR is inside the patient login section. Let's go ahead and log in as a patient. Once we log in as a patient, there's a wealth of information that we can see. For example, we can see the current and future appointments for this patient. We can see a health history including conditions, medications, allergies, vital signs, and more. We can see payment reports of all of the previous payments that this patient has made in the practice, a list of claims history, all of the claims that have been processed by that patient's insurance company. We can view scanned images that have been uploaded to the PHR directly from the EMR, and also our secure message center where patients can communicate securely with your practice. The patients also have the ability to make outstanding payments for claims and the ability to view and edit their patient profile. In the patient profile, they can update their demographic information and insurance information as well. One of the key sections of the PHR is the health history. On the health history section, patients can view their current assessments, medications, allergies, procedures, immunizations, and lab results. The PHR also allows the patient to view their scanned images. Those would be images that have been generated through the EHR and uploaded to the patient's PHR, and these images can be uploaded at the provider's discretion. Additionally, patients can also use the PHR Exchange section of the PHR to upload and securely connect to either a Google Health or Microsoft Health Vault account. Providing patients with this level of access to the information is quick and easy to set up. Simply sign up for the free MTBC website and be an active user of the MTBC EMR, and your patients will have immediate access to their clinical information.